Thank you so much, respected chairpersons, Dr. Goyal sir, Dr. Dalwai, Dr. Ravi, all respected uh, seniors in the audience and all my dear friends. सबसे पहले I want to know what are you being offered to stay back so late? Maybe there is some special gift for staying back so late. But I'll try and present something very quickly. And the topic basically what I'm going to talk about is vaccination and neurodevelopment, because I'm sure one of the biggest worries that we all have is whether vaccines cause any harm or damage to neurodevelopment. But as we have seen throughout the
Audio
day,
audio is not clear. Audio is not clear.
yeah, is this better?
No, it's still.
Yeah, better now? Yeah, so as we are aware, the development of vaccines is arguably the greatest medical achievement other than maybe ORS over the past 100 years, and millions of lives have been saved. But if you go back in history, even in the Egyptian tabloids, you will see that the cases of polio existed even then. And throughout the Middle Ages, there have been these stories of demons and other things where people were working on vaccines. And here you have Jenner in a beautiful piece of art showing how the process of inoculation actually started. Despite this great achievement, there has been a growing reluctance amongst parents to immunize their child, and we see vaccination failures or vaccination resistance being reported largely by WHO and UNICEF. And recent national estimates indicate that the immunization coverage is variable in most parts of the world. For example, in Canada, by 2 years of age, measles, mumps, and rubella, 94% children were covered, but only 70% were covered under for pertussis, tetanus, and H influenza B. So this is variable that we are seeing. At the same time, what we are seeing is significant outbreaks or public health consequences, new outbreaks of infectious diseases where we thought that these diseases were controlled. For example, measles, where it was formerly thought rare. And as you know that after the COVID-19 lockdown, these instances have increased all across the world. So let's look at what is the myth, what is the reality about vaccination and neurodevelopment, and we look at it in 4 or 5 buckets. The first bucket is obviously, undoubtedly, that vaccines ensure optimal neurodevelopmental outcomes. And there has to be no doubt about the fact that vaccination has led to dramatically decreased childhood disability from neurological complication of infections. And I want to tell this to all the parents and all those agencies who spread this false news that vaccines actually cause neurodisability and harm the child's brain. Not at all. In fact, it has decreased childhood disability. And all of you who practice this, and I have been hearing it all day, whether it is the BCG, DPT, JE vaccine, measles, rubella vaccine, all of them have undoubtedly helped to decrease the burden of morbidity as well as mortality in children across the world. And I'm sure all of us recognize the potential of vaccines decreasing infections and thereby decreasing childhood disability, whether it is congenital rubella syndrome, H influenza meningitis, polio, measles meningoencephalitis, SSPE, pertussis, JE, as very important tuberculous meningitis, because we all know that BCG has a documented protective effect against the meningitis component of tuberculosis and disseminated TB. And I remember Dr. Amdekar teaching us during rounds in the late 90s how BCG, even if it doesn't prevent the occurrence of TB, definitely decreases the incidence of the morbidity, mortality, and complications of TB. And hence, BCG vaccine has an essential effect on the motor disorders and plays a crucial role in what is known as neuroprotective management. I'm sure you know better about pertussis than me. In less than 1 year olds, more than 60% children may end up having apnea or hypoventilation, which may end up having neurodisability. Encephalopathy and seizures occur in about 3% of babies with pertussis, and many small studies have actually reported neurodevelopmental problems. I'm sure you're aware about reduced intelligence and especially the poor school performance that we talk about related to pertussis. Measles, I don't need to tell you, maybe 1 out of every 1,000 children who get measles will develop encephalitis, and this may result in hearing loss or intellectual disability. 1 to 3 of every 1,000 children with measles succumb to respiratory and neurological complications, and the risk of developing SSPE may be higher for a person who gets measles beneath 2 years of age. Having seen how vaccines actually prevent neurodevelopmental disorders, let's look at vaccine adverse effects. Let's look at the other side also, how it affects neurodevelopmental outcome. With decreased prevalence of infections following vaccination, now the potential neurodevelopmental complications of immunizations themselves are more talked about in society, in community, in academic circles. And studies have linked side effects such as benign febrile seizures with DTP and MMR. But safety is cited as the main concern by families who now refuse vaccines, especially the subsequent doses. And in particular, families are worried about the risk of neurological disease. No other worry exists for parents when it comes to vaccine. Nobody is worried about the rash. Nobody is worried just about a mild swelling or fever. What they are really worried about, neurological disease. And hence, there is an important issue to look at safety when it comes to vaccines and neurological disease. And the biggest issue that all of us are aware about is that vaccines were thought to cause autism, which is one of the largest. Just last month, there was a video that I had released. Some media house, Free Press Journal, had conducted an interview on autism on World Autism Day. And the biggest trolling I got was saying, what are you talking? Vaccines are the cause of autism, and all that you are saying is rubbish. So people who have no idea about who they are, where they are from all over the world, foreign names, you look at them, they are from some other country. I had nothing to do with vaccines in that talk, but anything that comes up with autism and you're talking about other management, they will troll you to make their voice heard. But what we know is basically there is significant evidence today to suggest that there is no causal effect or association between vaccinations and autism. And I will conclude by showing you how in my own practice I can prove to you that this is definitely the case. So immunizations may cause seizures or epilepsy is what most parents worry about. And febrile seizures have been shown to occur at increased rate after vaccination. But ladies and gentlemen, there is no evidence to suggest that fever caused by vaccines predisposes a person to seizures any more than fever from any cause. So whatever may be the cause of fever, maybe a natural infection or a vaccination, it is the same incidence of seizures thereafter. And hence when we go ahead, children with seizures after vaccination are not more likely to go on to have febrile seizures or any other developmental behavioral concerns than children who have febrile seizures from other non-vaccine related causes. And overall, there is no evidence to suggest that vaccines cause any kind of CNS injury, epilepsy or infantile spasms. And it's all a myth. And this entire story revolves around what is called children who experience an onset of neurological illness after immunization, and they are placed in this category of so-called vaccine encephalopathy. Have you heard of this? I'm sure. You've been reading about it, it gets reported in the newspapers, and there is a lot of scare and fear in our mind. There is no consensus definition as such of what is vaccine encephalopathy, but generally it is lumped together as children who experience developmental regression and seizures within 1 to 14 days after administration of any vaccine. But it is difficult to explain the lack of cause and effect to parents, because you imagine a parent who has come in, healthy child, gives a vaccine, goes home, gets fever, gets a seizure within a day or two, maybe goes on to get admitted. They might blame you, not just the vaccine, they'll blame you for giving the vaccine. They may want some compensation, they'll go and spoil your name. So this is very difficult, because parents, when they witness this seizures and especially thereafter developmental regression, so their question to you is, if it was not vaccine, then what caused this? Because my child was absolutely hale and hearty when I came to you for the vaccine. And hence, DTWP vaccine associated seizures, which is the commonest type of serious adverse event following immunization in India, has led and contributed and is worsening vaccine hesitancy. But today it is very clearly proved, sir, that genetic etiology in children is associated with the seizures or subsequent epilepsies, and it is a genetic predisposition and not just the vaccine that triggers autoimmune encephalitis. And hence, we need to now go ahead to the third bucket, how false messages link vaccines with adverse neurodevelopmental outcomes. And it's very important for all of us as pediatricians, because eventually the media or the people, the parents will all listen to us. Almost 2 decades after this controversy, where Lancet published a paper in 1998, it showed that autism is related to measles vaccination. 2 decades later, not one single study has been able to show an increased risk of autism following vaccines. And this hypothesized link between MMR vaccine and autism continues to cause havoc. No person who is involved with vaccination could have escaped being faced with this question of how MMR is linked with autism. So this link has been debunked because in a 2014 meta-analysis, 10 observational studies on childhood all reported no association. An MMR vaccine does not increase the risk for autism, does not trigger autism in susceptible children, and is not associated with clustering of autism cases after vaccination. But I will tell you later what actually is the trigger for children with autism, and it has nothing to do with MMR or any vaccination. This is just something I don't want to explain, but there is so much of evidence out there on how selected vaccine safety controversies are being created, but it's very clear in literature and it has been proved. So finally, I'll close by going to genetics, the final frontier, where we have this severe myoclonic epilepsy of infancy, which was known as Dravet syndrome, which is confused with vaccine encephalopathy. And that is because there is a great clinical similarity between the severe myoclonic epilepsy of infancy, SMEI, or Dravet as we know, in which syndrome the seizures present at around 6 to 7 months of age. Usually they are hemiclonic or generalized status epilepticus, and they are often associated with fever. Children remain neurologically normal till the second year of life, after which they frequently experience regression. And then other seizure types appear, including myoclonic, partial, and absence seizures, and the epilepsy is usually refractory to treatment. And this is very similar to the so-called picture of vaccine encephalopathy. But today it is very clearly known that Dravet syndrome or SMEI is basically due to mutations in the SCN1A gene, which was causative in about 80% of children with SMEI, and that 90% of these mutations arise de novo. Because parents will ask you that we never had any of these issues in our family. That's because most of them are de novo mutations, and this has been a very clear genetic cause for the disease. So many parents cite a lack of family history, but we have to explain that that is because these genetic changes are de novo. So today, as we know, the cases of vaccine encephalopathy have been shown to have a genetic mutation in the SCN1A mutations, but these are spontaneous and they are rarely inherited, though they are genetic. They resemble another disorder, which is SMEI, Dravet syndrome. The mutation explains the seizures and developmental regression in these patients. Vaccines are not the cause, not even the trigger. And as we know, mitochondrial disorders are rare genetic diseases. They may cause encephalopathy, rarely autistic features in affected patients. But now with so many vaccines being given, every month some vaccine or the other is being, so it's like you're walking on the road, a cat crosses your way and you call it bad luck that you will fail in the exam. Nowadays, if the population of the cats is increasing, more likely some cat is likely to cause your way. So more likely you might get more superstition. So this is what we must understand, that though these patients have an exacerbation in symptoms with febrile illness, there is no evidence that vaccines trigger these exacerbations. So what is a vaccine for children with neurodevelopmental concerns? Now the child already is identified as CP. He already has Down syndrome, or he has autism, or he has ADHD. Will you still give vaccines? The logic is very important. The children with neurodevelopmental disorders are in fact at greater risk of having medical complications if they get flu, and they may end up needing more hospitalization or even more mortality than the other children who don't have disorders. So the more children with NDDs receive flu vaccinations, the less dangerous complications will be experienced. So the high risk group of patients, those who already have seizures, those who already have neurodevelopmental regression, they need to be given vaccines. But unfortunately, look at the data. This is the group which will never go to a doctor for vaccination. And in fact, many of my friends tell me that the children with autism don't follow up with us because the societies or some elements in society are telling them, "Oh, doctor ने तुम्हारे बच्चे को vaccine दिया ना, इसके लिए ये हो गया." So only half of children are vaccinated for flu or receive vaccinations. So healthcare providers need to educate parents of children with neurodevelopmental disorders that the risk of complications is more in these children. And finally, I'm going to come to some observational studies in Indian scenario. I've been working for the last 21 years with a group of about 100 and 120 people in the city of Mumbai. What has been our observation about autism? I have not worked on vaccination, and I'm sure many of you are surprised to see me on a vaccine platform, but I'm going to tell you why. So somebody once this quote that when we interact, like right now, we are interacting with each other, we are impacting each other's biological state. So Sridhar told us about probiotics and microbes and how they affect us, our internal environment. But I am very sure that when we interact with each other, we are impacting each other's biological state externally and influencing the long-term construction of each other's brain. My brain is better because of all of you whom I have met across so many years. Had I not been a pediatrician, had I not been a part of IAP, I'm sure I would not have progressed as much as I have. And in fact, we can use this as an argument to convince those who are not yet members of IAP. Also, the important aspect of communication is really not just what you speak, but the ability to reciprocally interact, to speak back and forth, to reciprocally regulate each other's physiological state. How you speak to me makes me feel better, how I speak to you makes you feel better. And this basically creates relationships to enable individuals to feel good, nice, safe, protected. And this is especially so for children. And hence, working after 21 years in this field, at New Horizons, we have postulated what we call the New Horizons social behavioral communication milestones or sequence of social communication development. And unfortunately, most of us feel speech is the first development that we have to watch for. But speech is the fourth part on this. Can you see the screen clearly? Speech is the fourth milestone. So just like you have sitting, standing, walking, running, and then maybe jumping. This is the gross motor milestones that are described by Illingworth. Similarly, nobody described the milestones for social behavioral communication domain. So we have attempted to describe the milestones, and the first milestone is what we call Manush Magnata. After birth, how much is the child involved and looking towards other humans, engaged with the human world, wanting to look at mother, wanting to look at father, look at chachi, masi, bua, mami, rather than looking at objects. So the child who has a good human engagement, innate potential for attaching towards humans, then keeps looking at the mother, the father, starts understanding their behavior. Ki when the doorbell rings, only then the mother goes and opens the door. Otherwise, she does not open the door. So opening the door is not the point. When to open the door, when not to open the door is human behavior. And that the child can only learn by looking at the mother and the father throughout in the next 4, 5, 6 months after birth. And that can happen only if the child has this innate engagement with parents. Once this happens, the brain starts developing neuroplasticity, develops more towards other human beings, human behavior. By the time the child is 8, 9 months old, he starts understanding that this is not just a motor movement that my mother is doing. It is actually a symbol, a message that she is going away. This is not just a finger pointing that my mother is doing. She is telling me, look there. I need to pay attention to where this is pointing. This is, ladies and gentlemen, communication. It's the first sign of communication, and it is non-verbal. So this comes up by 9, 10 months of age. This helps the brain's neurodevelopment, neuroplasticity better. It arranges the brain in such a good manner that by 11, 12, 14, 15 months, the child is also able to understand कि इसके साथ एक आवाज भी आ रही है, बाय बाय. तो बाय बाय भी एक सिंबल है, आवाज नहीं है, उसका कुछ मतलब है. और जब आवाज का मतलब होता है, तब वो शब्द बनता है. When the sound is understood with a meaning, it becomes a word. And that becomes a meaningful word. A word with interaction with each other. And a word which is purposeful because we are calling out to each other for a purpose. And we use this anagram called IMP to tell you what is the true milestone of speech. If the word has interaction, I, M for meaningfulness and P for purposefulness, only then it is a normal or a normal milestone of speech. IMP, interactive, looking at the mother, saying mother in or ma or amma or I or whatever that meaningful is word is there in that language, and calling out to the mother because I need something, not just looking at the wall and saying mama, mama, mama. That is not the right thing. And speech can develop only after the brain has developed so much. 2 years of good speech, then you are ready to do ABCD or AIE. And what we are saying happens in autism, the first step goes wrong, so the child does not end up developing normal behavior or normal nonverbal or normal speech. But when the first step goes wrong, the child ends up focusing on objects. All objects are arranged in patterns. And this child, instead of becoming a human ustad, becomes a pattern ustad, and we call this Vastu Magnata. And hence this child develops rigid stereotypical behaviors, can recite poems, can recite alphabets, but does not know how to look at people, does not have eye contact, doesn't have good behavioral understanding, and does not have speech. And hence, this is the slide that I want all of you to see. If you look at when speech should develop, obviously speech develops around 8 to 12 months of age, but speech does not come at birth. But the vaccines that you are giving is after that, is after 9 months. But the point is, the problem with autism has started at birth, 8, 9 months before the measles vaccine is given. So I am putting it to you friends that the vaccine is much later, before that autism has occurred at birth, when the human engagement has not happened. Because human engagement is not there, वो मम्मी डैडी को देख नहीं रहा है, मनुष्य में उसका ध्यान नहीं है, तो मनुष्य कैसा बिहेव करता है. बेल बजी तो ही दरवाज़ा खोलना है, खाने का समय हो गया तो ही प्लेट लगाना है, खाने के बाद प्लेट सिंक में रखना है वॉश करने के लिए. ये बच्चा देख देख के सीखता है. एंड दिस इज 3rd, 4th, 5th month onwards, not after 10 months. So there is no question that the MMR can cause this. And hence we all have to pause and think that when we advocate all these kinds of influences in people's life, whether it's a medicine or it's a vaccine, I'm sure all of us understand that we don't want to do any harm. And Robert Hutchinson told us that don't do something that may harm the person, but not giving the right information. Not giving the right information to people is also going to harm them. And as William Osler said, one of our first duties is, like Dr. Amdekar said, first lecture in the afternoon, and I'm ending it the last one, that it is our job as a person, as a human being, as a counselor, as a friend of the family, that is more important than what we prescribe. And hence my take home messages would be, vaccines ensure optimal neurodevelopmental outcomes in many diseases. The hypothesized link between MMR vaccine and autism causes concern and vaccine hesitancy, but there is absolutely no connection. What was called vaccine encephalopathy is actually a genetic mutation. Similarly, the cause of autism needs to have a new look after 80 years after Leo Kanner described it. Parent awareness and partnership is the most important tool we have. It's not our stethoscope. It's not the injection. It's not the syringe. It's the parent awareness and partnership with the pediatrician that is the most important tool. And as we advance scientifically in the 21st century with science at the touch of a button, may we learn to balance judiciously not just the knowledge of antibiotics or pro-microbiota, but judiciously balance humanity, medicine, ethics, and economics. And hence, I would go so ahead to tell the vaccine makers that now we need some new vaccines, and we need a vaccine for pediatricians also. What is the vaccine we need for pediatricians? So this is from Calvin and Hobbes, and he's telling Hobbes that if you can find even one person you really like, you are lucky. Because mother, father may be so busy with their own life or wanting the child to come first in the exam or marry whoever the father or the mother wants the child to marry or go to whichever course. Nobody is there who likes you for who you are. So I want to hope that there is a vaccine that pediatricians can take that can make them be that person for every child. That it's not just our MD degree or our DCH that is important for us to go. We need a vaccine that will make us care for each and every child. Because those who wish to sing always find a song, and I'm sure everybody in this hall will do that. So I will end with my wish list for new vaccine development. Somebody, Tanuda was telling me yesterday about the vaccine for dengue and how we are going to bring up a new program on dengue in IAP as action plan program. But here is my wish list for new vaccine development. I would pray that somebody discovers a vaccine which will reduce screen time, not only of the child, but also of the parents, and also one more P, the pediatrician. I hope that some of you are intelligent enough and good enough to develop a vaccine for increasing human engagement and human interaction. And maybe one of us, who is as intelligent as Dr. Hemant Joshi sir, can come up with a vaccine for greater human affection, for empathy towards each other, for tolerance and coexistence, that all of us can live happily ever after. And a vaccine that induces fraternity, liberty, and equality amongst all of us. So if this is the vaccine which gives, thank you, health for all, there have to be a vaccine also for the heart and a vaccine for the brain. And on what line should this vaccine be developed was told to us not by a scientist but by Shailendra ji, who wrote that किसी की मुस्कुराहटों पे हो निसार, किसी का दर्द मिल सके तो ले उधार, किसी के वास्ते हो तेरे दिल में प्यार, जीना इसी का नाम है. So maybe pray, ऊपर वाला करे, that there is a vaccination that all of us take, which we can develop all this. Thank you so much. Thank you so much. Thank you so much.
Thank you, Samir Dalwai sir. Now time is 7:45 p.m. This was the last lecture. It was a very difficult to give last lecture, but see the charisma of Samir Dalwai sir. Everybody was listening curiously, and I like all sir said vaccine benefits. First slide, second slide, vaccine risk is less than the benefit. Third slide he explained regarding autism, MMR and autism association. He explained very well social interaction, social behavior, and non-verbal communication comes before 6 to 8 months, and we give vaccine at the 9 months. So she has explained very well relation between MMR and autism. There is no relation. And also sir said ki neurodevelopment disorders, the patient with these disorders need vaccine more. They are a high risk criteria. Vaccines should be given to such a patients on priority basis. Thank you, Dalwai sir. Thank you, Gohil sir, and thank you, Nirmal sir.
Thank you so much. I would again request all our esteemed dignitaries to please pick up the token of appreciation for you joining us on this VACCIIDCON 2024, and I request each one of you to be seated as we are going to have a felicitation ceremony now. So I would like to have each one of you to be there in the hall. We'll be having a very small, very short felicitation ceremony. And I appreciate each one of you being present here since morning, and I hope you have enjoyed and you have gained lots of knowledge related to vaccines and the new upcoming demands of the vaccines and what is required and what is not required. Thank you for being such a lovely audience. But now, moving ahead with the felicitation ceremony.